Hello, I'm Dave Junkin. I'm one of the sports medicine specialists at Seaview Orthopaedics. Today we want to discuss the Regeneten Patch. What I'm about to show are a few case examples when I use the Regeneten Patch. These two examples are partial thickness tears. What that means is that the tendon, for the most part, is still attached to the bone and only has a portion of the tendon torn. This example is from an inside view of the shoulder arthroscopically. This white area here is the top of the humerus or the ball. This is all the normal cartilage. This is what this is supposed to look like. It's absolutely pristine. This here is the biceps tendon. There's one biceps tendon that enters our shoulder joint. And then this is, again, the rotator cuff coming down in this view. This is more towards the front edge, and this is then looking down the entirety of the superior rotator cuff. This is all normal in appearance. This is a healthy looking rotator cuff from this perspective. This view now is from the subacromial space. The subacromial space is below the bone or the roof of the shoulder, part of the shoulder blade. So my pen is in the subacromial space currently. The rotator cuff would be below, so now we're looking down on the outer surface of the rotator cuff. This view, looking from back towards the front, this individual had a partial tear right in here. This is looking at that same tear now from the side view. I then took an arthroscopic shaver and cleaned that area up, or debrided the tear, removing the portion that was torn. There is still much of the tendon still attached below, as we could see from the interarticular view that the tendon was normal. These type of tears, called a burstal tear, can be quite painful and symptomatic. Therefore, this is where the Regeneten Patch can be very beneficial. The Regeneten Patch is about the size of a postage stamp. It is outlined in blue, so it can easily be found or seen arthroscopically. It is laid directly onto the tendon. That torn portion was about in this region. It is then secured with devices that place these absorbable purple staples. Over here, I'm actually putting in a staple that's on the lateral portion, which would be where it would then be attached to the bone, putting in these white staples. This is looking from the side. So these staples are to incorporate it or attach it to the bone, where the purple staples are to attach it to the underlying cuff. The next example would be a tear we more commonly see. This is an interarticular partial tear. So this is the opposite shoulder. Here's the cartilage. As I pointed out in the previous example, the biceps tendon is below, and here's the rotator cuff coming down. As we can see, there is separation from the edge of the cartilage to where we see normal attaching fiber. So this is all a partial tear in this region here. This is after this has been arthroscopically debrided or cleaned up. Typically then I put a stitch through it using a spinal needle so I can identify that location from the subacromial view. I'm now in the subacromial view. I had identified that this is the region where that partial tear was on the other surface. I'm now inserting the Regeneten Patch. It is rolled up like a cigar in a delivery system that then opens and flattens it out, holding it in place to then place these staples. This is the device to put in these absorbable staples. I'm securing it to the tendon below, and this is after it's been secured, multiple views demonstrating it adhering to the cuff below. I've been using the Regeneten Patch now for about 4.5 years in my practice. I am very happy with the results. If it's something you like to see, if you are a candidate for this procedure, feel free to contact CVU offices for an appointment.